Hello, today we're going to be doing Chapter 5, Culturally Respectful Care. We'll be discussing the essential knowledge and skills that you need to understand for cultural diversity, for providing thoughtful, person-centered, culturally respectful care. These are essential components of the nursing practice. This chapter will focus on the concepts of cultural diversity and cultural respect and how they influence your nursing care. When we talk about cultural diversity, we talk about the ability to live and socialize and get along with people that are different from us, different because of their religion, different because they speak a different language, different in size, different in sexual orientation, different in age groups, different because they have disabilities, different because of their occupation or their geographical location. Culture itself is an important part of both health and illness because of cultural values and beliefs that we learn growing up from our families and our communities. Nurses have to be familiar with the concept of cultural diversity in order to understand certain characteristics common to some populations. Nurses also have to be sensitive to cultural factors in order to provide culturally respectful care to people with different backgrounds or diverse backgrounds. The concept of cultural respect allows nurses to be able to deliver services that are respectful of and responsive to health beliefs, practices, cultural, and linguistic needs of diverse patients. Cultural respect is critical to reducing healthcare disparities and improving access to healthcare, high quality healthcare to all people. It's also vital to remember that each person may be a member of a multiple cultural, ethnic, or racial group at one time, meaning they may engage in different practices, not just ones that are for their culture, maybe multiple cultures. Different cultural values can guide a person in different situations based on what's most important to that person at that time. Also, people should be viewed as individuals, not as a representative of a specific cultural group. Culture itself is a shared system of beliefs, values, and behavioral expectations that provides a structure for us for daily living. And it's defined by the community that we grow up in or by the people that we grow up around. NIH defines culture as a combination of body of knowledge, a body of belief, and a body of behavior. Elements included in culture are the way we identify ourselves as a person, the language that we speak, our thoughts, our communications, our actions, our customs, our beliefs, and our values. These values are typically apparent in the attitudes and the institutions that are unique to a particular group, and the elements influence the roles and the interactions with others and with families in the community. For nurses who practice thoughtful person-centered care, these elements will influence beliefs and belief systems surrounding health, healing, wellness, illness, disease, and the delivery of healthcare services. So a couple tips I like to give you for reading questions is ask the last question in the statement first. Which action by the nurse demonstrates the delivery of culturally sensitive care to clients? Select all that apply. Nurse is caring for a group of clients. Which action by the nurse demonstrates the delivery of culturally sensitive care to the clients? This helps you put into perspective what the author is actually asking. And then when you read your answer choices, start with E and go up. Okay? The nurse, which action by the nurse demonstrates the delivery of culturally sensitive care to the clients? The nurse is caring for a group of clients, which action by the nurse demonstrates the delivery of culturally sensitive care to the clients? E. Maintaining direct eye contact during conversations with all cultural groups. I would say no to that because some cultures do not like direct eye contact, while in the United States it's considered truth telling. In several other countries, it's a sign of disrespect, indicating that the cultural groups should adapt to the dominant culture. That might be considered a type of cultural imposition because cultural imposition is the belief that everyone should conform to your own belief system. Integrating the client's cultural practices when assisting the creation of the care plan. You would want to consider the client's cultural practices, correct? Allowing the client to wear their religious necklace until going into the operating room. Another thing that you would want to do to show respect. Asking the client questions regarding healthcare beliefs related to the client's culture. So instead of assuming, we're asking here so that we can provide the best culturally competent care. There are many ways that a nurse can deliver culturally sensitive care, but priority is understanding the differences in culture and integrating those beliefs into the care delivery system. Asking questions related to the culture is important because not all cultural groups follow a general belief or practice. This should be considered whenever the plan of care is being developed, allowing the client to wear that religious necklace until they go into the operating room and then keeping it in a safe place until they return is a demonstration of cultural sensitivity. Implying that a cultural group should adapt to the dominant culture is not culturally sensitive. Not all cultural groups respond to direct eye contact, and the nurse should be aware of how that may be perceived. Remember that culture influences our role and our interaction with others as well as within the family, the community, and it can be apparent in our attitudes. The characteristics of culture should include the following. The culture helps shape what's acceptable behavior for people in a specific group. It's shared by and it provides an identity for members of that same cultural group. It's learned by each new generation through formal and informal life experiences, and language is the primary means of transmitting culture. The practices of a particular culture will often arise because of the group's social and physical environment. Cultural practices and beliefs can evolve over time, but they remain constant as long as they satisfy the group's needs. Culture can influence the way people of a group look at themselves, have expectations, or behave in response to certain situations. Because culture is made up of people, there are differences within cultures and among cultures. Within most cultures, you'll find a subculture. This is a large group of people that are members of the larger cultural group, but they have certain ethnic, occupational, or physical characteristics that are not common to the larger group. For example, nursing is a subculture of the larger healthcare system culture. Teenagers and older adults are regarded also as subcultures of the general population in the United States. Most societies have a dominant culture group and a minority culture group. The dominant group has the greater ability to control the values and the sanctions of that society. It usually is the largest group in society. Minority groups have some physical or cultural characteristics like race, religious background, or occupations that may be different from those in the dominant group. When the minority group lives within that dominant group, many members can lose the cultural characteristics that once made them different as they begin to take on the values of the dominant culture. This is called cultural assimilation or acculturation. For example, when people move in to a new dominant culture, as they start to work, they go to school, they learn the dominant language, they also move closer to the dominant culture. So some of you may have children if you've moved from a different country that are engaging in this. They want to wear those jeans that the kids here wear. They want to go to McDonald's. They might not want to eat those traditional foods or engage in some of those traditional things that you remember as a child. This assimilation rate can be different for everybody. Mutual cultural assimilation also occurs with both groups taking on some characteristics of the other. For example, some Hispanic people that have moved to the United States have learned to speak English. Many Americans will also learn to cook and enjoy those traditional Hispanic foods. So we all gain from the different cultures that we're exposed to and that we live with. We might not think about it much, but the clothes we wear, the food we eat, the music we enjoy, a lot of the words that we use, and a lot of the activities that we do for fun are all influenced by acculturation. Culture shock is when someone's placed in a different culture that they perceive as strange, and this can result in psychological discomfort or disturbances because of the behavior. The person's behavior might be acceptable in their own culture, but not necessarily in that new culture. Typically, there are two groups in society, a dominant group and a minority group. The dominant group is much more efficient at controlling the values and the sanctions of society, and they're usually the larger group. The minority group will usually have some physical or cultural characteristics that are different from those in the dominant group, like their race, their religious beliefs, or their occupation. When minority groups live within a dominant group, several members may lose the cultural characteristics that once made them different. They begin to take on the values of the dominant culture. This process is called cultural assimilation or acculturation. You may see it with your children. For example, you've moved to the United States and some of them are speaking English now. They're going to school. You're starting to see the values that they previously had replaced by the values of this new culture that they've moved into or migrated into. For things, for instance, they might, instead of traditional foods, want to eat McDonald's. Instead of the clothes maybe that you wore back home, they want to wear blue jeans or Nikes or things that the other kids here are wearing. So they become closer to that dominant culture. Mutual cultural assimilation can also occur. So both groups will take on some characteristics of the other group. For example, when Hispanic people migrate to the United States, they'll learn to speak English, and Americans will also learn to cook and enjoy traditional Hispanic foods. So we gain from the cultures in which we're exposed to. Although we seldom think about it, the clothes we wear, the foods we eat, the music we enjoy, the leisure activities we practice are all influenced by acculturation. Cultural shock is when we put someone in a culture that's different from what they're accustomed to and they perceive it as strange. This can cause psychological discomfort or disturbances because the patterns of behavior that the person may have found acceptable in their own culture might not be adequate or acceptable in that new culture. This can make people feel foolish, fearful, incompetent, humiliated, and eventually it leads to frustration, anxiety, and loss of self esteem. So we only have one question here. Which of the following occurs when members of a minority group living within a dominant group begin to blend in and lose the characteristics that made them distinct? So cultural shock, that's D. And we said cultural shock is when you put someone in a different culture that they perceive as strange and it causes discomfort, psychological disturbances, and it makes them feel incompetent or inadequate because their behaviors may not be acceptable. So I don't think it's that one. We said that cultural assimilation was when people move into a new culture that's dominant and they start to move closer to that dominant culture by assimilating things like the values, the language, maybe wearing the jeans that they wear, eating the foods that they wear. So that sounds like it could be cultural assimilation. What is cultural conflict? Cultural conflict occurs when people become aware of cultural differences, they feel threatened, and they respond by making fun of the beliefs and traditions that other people have to make themselves feel more secure about their own beliefs. And cultural imposition is the belief that everyone should conform to your beliefs and believe what you believe. Okay, so the best answer choice here would be cultural assimilation. And again, cultural assimilation occurs when your values are replaced by the values of the dominant culture that you're living in. Cultural imposition is the belief that everyone should conform to the majority belief system. Cultural conflict occurs when people become aware of cultural differences, feel threatened, and make fun of those other cultural traditions. And cultural shock is when the feelings of the person that is experiencing the different culture is a negative feeling or makes them feel incompetent or out of place because their values are different from what is currently occurring in that culture that they're placed into. Ethnicity is identification within a specific cultural group, and it's based on common heritage. So you belong to a specific ethnic group or group through birth or through adoption of certain characteristics of that group. People that are in a specific ethnic group will share unique cultural and social beliefs, behavior patterns. These things would include language, dialect, religious practices, literature, folklore, political interests, food preferences, employment patterns. Ethnicity mostly depends on day-to-day life with your family and friends within that community. Many people still use ethnicity and race interchangeably. However, they are not the same. Race is based on specific physical characteristics like pigmentation of the skin, body stature, facial features, or texture of the hair. Because there's been significant blending of physical characteristic throughout the years, race is harder now to define using simple physical characteristics, and it's not considered a reliable way to determine someone's race. Federal standards for classification of race include 5 categories: Native American or Alaskan Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, and white. These provide the opportunity for people to identify themselves in multiple categories. Some factors that inhibit our ability to see people as unique and diverse individuals is our sensitivity. For example, stereotyping, when we assume that all people of the culture, ethnic group, or race act alike. Stereotyping could be positive or negative. Negative stereotyping usually includes racism, ageism, and sexism. Mistaken beliefs that certain races, certain age groups, or biological sex is inherently superior to others. This causes discrimination against those that are considered inferior. So, what assumptions might you bring to your encounters with these people? You should be aware of any personal biases that could influence your way to the way that you respond to them. A lot of times we're not. So maybe you're Catholic, you're against abortion, and someone comes into you and they need an abortion. Okay. Would it matter the reason? Would you be okay with it? Would you be able to take care of that person without inflicting your values, your thoughts, your attitudes upon them? We hold attitudes towards people or we associate stereotypes with them without being aware of it. This is called implicit bias. There is a implicit bias test that you could take. You should check it out. There's a link for it in your book on page 99. Okay, and it might teach you something about yourself that you might not be aware of. Cultural imposition. Again, this is the belief that everyone should conform to your own belief system, and cultural blindness is when you ignore differences between the cultural group and you act as if they don't exist. Cultural imposition and cultural blindness can be seen in the healthcare system, especially when we talk about non-mainstream methods of care. So again, we go back to things like even blood transfusions. Okay, how do people feel about it? Culture conflict happens when people become aware of cultural differences and they feel threatened, and so they start to make up or make fun of the beliefs and the traditions of other people to try to make themselves feel more secure. Let's look at this question. What cultural factor can the new nurse assess from this conversation? A newly hired young nurse overheard the charge nurse talking with an older nurse on the unit. The charge nurse said, "All these young nurses think they can come in late and leave early." What cultural factor can the new nurse assess from this conversation? Again, let's look at the choices starting with D. Cultural imposition. Cultural imposition is the belief that everyone else should conform to your belief system. Cultural conflict happens when people become aware of cultural differences and feel threatened and respond by making fun of the beliefs and traditions of other people to make themselves feel more secure. Cultural blindness happens when we ignore the differences and act as if they do not exist. And stereotyping could be positive or negative. Negative stereotyping includes racism, ageism, and sexism. This is an example of ageism. Here, the charge nurse is clearly exhibiting ageism, which is a form of stereotyping. Cultural assimilation is when one begins to assume some characteristics of a culture outside of their own. Cultural blindness occurs when cultural differences are ignored, and cultural imposition when one pushes one's cultural beliefs onto someone else. Now we'll talk about some cultural influences on healthcare. The United States is a multicultural, multi-ethnic, multiracial country. So as a nurse here, you have to be aware of and sensitive to the needs of this diverse client population. Most people interpret behaviors of others in terms of their own culture, and this can work both ways. For example, the nurse is evaluating the attitudes and the actions of the client. At the same time, the client is also evaluating the attitudes and the actions of the nurse. What might seem reasonable and important to a client may seem ridiculous and irrelevant to an insensitive nurse. The reverse is also true. Now, your book also discussed about how there's been some changes because we have such a blend with races now. We're not separate, people are blending, and so some of those changes are occurring in their physiological presentation, in their cultural beliefs and values. It also talks about something called intersectionality, and this looks at how a person identifies, such as their gender, their ethnicity, and their sexuality. It can also affect their access to opportunities and privileges. This term has been around for a little bit of time. Intersectionality is an analytical framework, and it's used to study how societies treat people based on their various social and political identity, such as their gender, their ethnicity, and the sexuality. Depending on those identities, a person may be privileged or oppressed. For physiological variations, studies have shown that certain racial or ethnic groups are more prone to being diagnosed with certain diseases or conditions. For example, Tay-Sachs disease, a hereditary disorder, is typically more associated with people of Eastern European Jewish descent. However, according to the newer understanding of race as a socially constructed concept, the fact that cirrhosis of the liver and fetal alcohol syndrome are found more frequently in Native Americans and Alaskan natives does not mean that these individuals have a genetic propensity for the disease, but rather that structural racism in the United States and elsewhere has produced living circumstances that promote these disorders more frequently in these communities. A critical distinction here. Research has also shown us that expressions and behaviors exhibited by people in pain are culturally prescribed. Some cultures allow or even encourage open expression of emotions related to pain. Other cultures encourage suppression of such emotions. So you cannot assume that a patient that does not complain of pain is not having pain. You may overlook the pain reduction needs of a client who deals with pain quietly or stoically. To avoid that error, you need to be sensitive to nonverbal signs of discomfort, such as holding or applying pressure to a painful area, avoiding activities that might intensify the pain, and uncontrollable spontaneous expressions of discomfort, such as facial grimacing and moaning. You should also not consider clients who freely express their discomfort as a constant complainer with excessive requests for pain relief. Pain is a warning sign from the body that something is wrong, and it is what the client says it is. Every complaint should be assessed carefully. Therefore, we have to recognize that culture is an important component of individuality, and people hold their own beliefs about pain and have a right to. Respect the client's right to respond to pain in their own manner, and do not stereotype a client's perception of or response to pain based on their culture. There are also variations when it comes to mental health. Most of the data collected regarding mental health was made of white middle class people. Other ethnic groups have their own respectable patterns of behavior for psychological well being, as well as different psychological reactions to situations that occur. For example, Hispanic people tend to deal with problems in the family and they do not consider it appropriate to tell their problems to a stranger. Chinese people consider mental health a stigma and they look for psychiatric help as a disgrace to the family. Even in Japan, like considering suicide is considered heroic. That's not considered something that they would be depressed about. If someone there were to commit suicide, they would actually consider that a heroic act. In Puerto Rican people, in times of high stress or anxiety, these clients may demonstrate a hyperkinetic seizure-like activity known as ataques. This behavior is a culturally accepted reaction, so be aware of the variations and accept them as culturally appropriate. You should also be aware that in some cultures, the man is the dominant figure and would make the decisions regarding any family members. For example, if approval was needed for medical care, he may be the one to give it, regardless of the family member that is ill. In male dominant cultures, women will be passive, and in some cultures, women may be dominant. Knowing who the dominant person is important because that dominant person will be the one making the decisions most of the time. However, when that person is ill and can no longer make decisions, the whole family may become anxious and confused. If a non dominant family member is ill, this person may need help in verbalizing the needs, especially if those needs differ from what the dominant member perceives as being the priority or of importance. When English is not the dominant language, they may speak their own language fluently but have difficulty speaking English. This is especially true if the family member or the person doesn't work outside the home or if they live in close proximity to others who speak the primary language. Assimilation is likewise slower for people that stay at home, especially if they're in a community of their ethnic or cultural background. Children tend to assimilate more rapidly and learn the language of the dominant culture quickly if they leave home to go to school, make new friends, or are out there working in that dominant culture. Wage earners also tend to learn a new language quicker because they're working out there where the language is being spoken daily. Language acquisition is tied to necessity and assimilation rather than to degree of difficulty. Remember to be patient as there are many different languages spoken in the United States, different dialects. Patients may forget English words or become more familiar with their own language when they're under stress than they are with the English language. Linguistic competence is the ability of the caregiver or the organization to understand and respond to the linguistic need of the client and their family during that healthcare encounter. Nurses that work in geographic areas with a high population of residents who speak languages other than English should learn pertinent words and phrases in that language. To avoid misinterpretation of question and answers, it's important to use an interpreter who understands the healthcare system. Sometimes a family member or a friend can translate, but the person may be protective and may not be the most reliable means of transferring information. So guidelines discourage using family members or friends as translators. One of the most culturally variable forms of nonverbal communication is eye contact. The American dominant culture emphasizes eye contact while speaking, but for many other cultures, this behavior is regarded in other ways. For example, direct eye contact may be considered impolite or aggressive by people who are Asian, Native American, Indo-Chinese, Middle Eastern, and North American. People from these groups may avert their eyes while speaking. When caring for a patient from a cultural or ethnic group different from your own, it's important to perform a transcultural assessment of communication. What language does the client speak when they're performing ADLs? How well does the client speak and write English? Does the client need an interpreter? How does the client prefer to be addressed? What cultural values and beliefs of the client may change your techniques, such as eye contact, personal space, social taboos, etc.? How does the nonverbal client behavior affect the responses of the members of the team? What are cultural characteristics of the client's communications with others? Orientation to time and space. Personal space is the area around someone, regarded as part of that person. This is individual to each person, different cultures, and ethnic groups. And others should not intrude during personal interactions. If others do not consider a person's personal space personal, that person may become uncomfortable or even angry. When providing care that involves physical contact, you should know about the patient's cultural personal space and preferences. For example, people from Middle Eastern and African cultures commonly sit and stand close to one another when talking, whereas some people from Asian and European cultures tend to have more distance between themselves and others. Food preferences and preparations are different and they're culturally influenced. Certain food groups are staples of the diet based on the culture and remain so even when members of that culture are living in a different country. Clients that are in long-term care or hospital setting do not often have choice for the foods that they're consuming. This means that people with cultural food preferences may not be able to select appealing foods and they may be at risk for inadequate nutrition. When assessing the causes of a client's decreased appetite, try to determine whether the problem may be related to the culture. And if possible, consider asking family or friends to bring in foods that would satisfy the nutritional needs of the client while still meeting the dietary restrictions. Dietary teaching has to be individualized according to the cultural values. In many cultural and ethnic groups, people have a large extended family, so consider the needs of any family member to be equal or greater than that of their own. They may be unwilling to share private information about family members with those outside the family, and this includes the healthcare team. Other cultural groups have great respect for the elders in the family and would never consider institutional care for them. Include the family in planning care for any client. This is a major component in nursing care that helps meet the client's individual needs, especially if those needs can only be met through consideration of all family members. Low income is a major problem in the U.S. and often described as having created a culture of poverty. A person whose family's total income falls below a certain level for the size of that family, or a person whose income falls below an established threshold, is considered to be experiencing poverty. The U.S. Census Bureau defines poverty according to money or income guidelines that vary by family size and composition. No matter how poverty is defined, it's an increasing, devastating epidemic fueled by real estate foreclosures and credit debt that's evolved into a culture of its own. At highest risk are children, older people, and families headed by single moms and future generations of those now living in poverty. Poverty often leads to problems such as lack of health insurance, inadequate care of infants and children, lack of access to basic healthcare services, and homelessness. Research has shown that poverty leads to certain feelings in clients and families, and that it's passed on from generation to generation. And cultures will often have the following characteristics: feelings of despair, a day-to-day attitude towards life with no hope for future, unemployment and need for financial or government aid, unstable family structures, and a decline in self-respect and retreat from the community. And it's long been a barrier to adequate health care. It prevents people from consistently meeting their basic human needs. And when low income housing is available, it sometimes lacks other necessities, things like running water, heat, and electricity. So people have to pull resources, conserve their money, try to stretch it, live in crowded conditions, and all those things can lead to psychological problems. It can lead to feelings of low self-esteem, self-worthlessness. It also contributes to increased incidence and severity of disease and illness because of the closer proximity of people, sharing of utensils and belongings, poor sanitation, and poor health habits. The term health disparities refers to health differences between groups of people. This can affect how frequently a disease affects a group, how many people get sick, or how often the disease causes death. Many populations are affected by disparities, including racial and ethnic minorities, residents of rural areas, women, children, and older adults, and people with disabilities. People's values and beliefs about health, illness, and healthcare are influenced by their cultural, ethnic, or religious groups. For example, in some groups, illnesses are classified as either natural or unnatural, and they believe that natural illnesses are caused by things like cold air or impurities in the air, water, and food, whereas unnatural illnesses are punishments for not following the rules of God, resulting in evil forces or witchcraft, which cause physical or mental health issues. In some cultures, the power to heal is thought to be a gift from God, and it's only given to certain people. People in these cultures believe that folk or traditional healers know what is wrong with them and can fix it. A patient accustomed to traditional healers may think that healthcare providers are incompetent because they ask a lot of questions before they're able to treat an illness, where traditional healers will speak the patient's primary language, are often easily accessible, and more understanding of the client's cultural or personal needs. People from different cultures also have different beliefs about how to treat an illness or a disease. Some believe in herbs, some believe in medications that have a basis in herbs or other plant sources. Some believe in things like cupping, certain teas. There are different traditional therapies that use cutaneous stimulation, therapeutic touch, acupuncture, or acupressure. Therapeutic touch is an intentional act that involves energy transfer from the healer to the client to stimulate the client's own healing potential. Acupuncture is a way of preventing, diagnosing, and treating the pain and disease by using special needles inserted into the body at certain locations. And acupressure involves deep pressure massage of appropriate points in the body. Being able to provide culturally respectful nursing means that the care is planned and implemented in a way that is sensitive to the needs of the individual, their family, their group, from all populations within society. Among the elements of cultural competence are being able to develop an awareness of your own existence, sensation, thoughts, and environment so that they don't influence other people from other backgrounds, demonstrating knowledge and understanding of the client's culture, health related needs, and culturally specific meanings of health and illness, accepting and respecting the cultural differences in a manner that promotes the patient and family's ability to make decisions on their own to meet the needs and beliefs. Not assuming that the healthcare provider's beliefs and values are the same as the client's. Resisting judgmental attitudes such as different is not as good. Being open to and comfortable with cultural encounters and accepting responsibility for your own education in cultural competence by attending conferences, reading professional literature, and observing cultural practices. Ethnocentrism is similar to cultural imposition. The belief that the ideas, beliefs, and practices of our own culture is superior to someone else's culture is ethnocentrism. When we assume that we have the right to make choices and decisions for our clients of another culture, the client may respond in the same way that minority cultures respond to such an attitude by the dominant culture. Clients may become passive, resistive, angry, or resistant to treatment. Nurses must be willing to examine and carefully clarify their own attitudes and values to be sensitive to others that are different. A nurse's role is to understand the client needs and adapt her care carefully and respectfully to meet those needs. Cultural humility is the recognition of diversity and power imbalances among individuals, groups, or communities with the action of being open, self aware, egoless, flexible, exuding respect and supportive actions, focusing on both self and others to formulate a tailored response. Cultural humility is a process of critical self reflection and lifelong learning, and it results in mutually positive outcomes. Which term describes what occurs when a nurse believes that one's own ideas, beliefs, and practices are the best or superior to those of colleagues and patients? Look at your answer choices there. Ethnocentrism is what? That is when we believe that our beliefs, our ideas, our practices are the best or superior to those of others. Stereotyping, what is that? Okay, so if you said that it's the belief that all members of a culture, ethnic group, or race act alike, then you are correct. What is culture shock? Okay, culture shock is when we're placed in a different culture that we perceive as strange and it causes psychological discomfort or disturbances because behaviors may not be acceptable. And what is cultural diversity? Cultural diversity is the coexistence of different ethnic, sex assigned, racial, and socioeconomical groups within one social unit where the groups are able to interact with one another and it's multiple groups. So again, ethnocentrism is the belief that one's ideas, beliefs, and practices are superior or preferred to those of others. Cultural diversity refers to the existence of diverse groups in society with varying cultural characteristics. Culture shock is the feelings a person experiences when placed in a different culture, and stereotyping is the practice of assuming that all members of a cultural group act alike. So we want to engage in cultural competence. Having cultural competence means that we understand the beliefs, the values, the traditions, and the practices of a culture, that we're trying to meet the culturally defined health related needs of an individual, family, and community, that we understand the culturally based belief system of the etiology of the illness and disease and those related to health and healing, and that we seek attitudes that help us and help these clients seek help from healthcare providers. Also, when we care for clients from a different culture, we want to ask how they want to be treated based on their values and beliefs. The primary informant should be the client if possible. We need to perform a cultural assessment. If the client's not able to respond to the questions, a family member or a friend can be consulted. We can use tools like the Andrews tool or the Geiger and David Hisser and Purnell model for transcultural competence. These models take into account communication, space, social orientation, time, environmental controls, and biological variations. The Campina-Bocote model, or this is a model of cultural competence, and this emphasizes becoming culturally competent and integrating cultural awareness, cultural knowledge, skills, that cultural encounter, and cultural desires. The transcultural health assessment. Ask the client why they believe that they're ill. Ask the client about their beliefs, about the ideal body size and shape, and what their self-image is compared to what their norm should be. What name does the client give to their healthcare related condition? What does the patient believe promotes health? What is the patient's religious affiliation? Does the patient rely on cultural healers? Who determines when the client is sick and when the client is healthy? What types of cultural healing practices does the client engage in? How are scientific healthcare providers perceived? How does the client's family perceive healthcare and nursing care? What comprises appropriate sick role behavior? How does the client's cultural group look at mental health disorders? Who determines what symptoms constitute the disease? So there's a variety of questions here that you can ask the client to find out, who they are, what they believe in, and how to guide their care. A nurse that's culturally respectful has the knowledge and the skills that they need to adapt their care to cultural similarities and differences. Cultural competence takes time. You have to develop awareness, acquire knowledge, practice skills. Each patient or client must be considered a unique person, even if two people have the same cultural backgrounds. Which aspects of nursing make it recognizable as a subculture? Select all that apply. So sensitive use of time, talent for planning, rituals, language used, manner of dress. Nurses are recognizable as a subgroup in a number of ways. Their legally sanctioned authoritative stance versus clients and the general public, their manner of dress, their language, and the rituals and ritualized behaviors into which nurses are socialized as nurses. Talent for planning and sensitivity to the use of time are values of nurses that reflect the dominant group.